Hello, I'm Ty Mason of the DiabetesCouncil.com, researcher, writer, and I have type 2 diabetes. I want to emphasize that my perspective is coming from one with type 2 and not type 1 diabetes. Our channel is primarily for those with type 2 diabetes and pre-diabetes. Today, I want to answer the question, if I have pre-diabetes, can I avoid developing diabetes? After you watch the video today, I invite you to check out the description box for my new ebook. This is one of the most comprehensive diabetes meal planning books you'll find anywhere. It contains diabetes-friendly meals and recipes for different goals such as 800 to 1800 calories per day meal plans, diabetes meal planning and tips and tricks, and there are also tons of diabetes-friendly recipes for everyone. I am very happy to announce to you that the answer to this question is a resounding yes, especially if your diagnosis is early. However, you must, and I must emphasize must, make some dramatic lifestyle changes in order to do so. Now, I've done a couple of videos on these lifestyle changes, but I certainly don't mind doing another if it can help you from developing type 2. How is prediabetes treated? Well, there is an increasing evidence that if prediabetes is treated, the progression to diabetes can be prevented. Also, it may be possible to prevent cardiovascular disease from developing. So it is important to know if you have prediabetes and to treat it in order to reduce your risk of developing these diseases. Treatments that have been suggested include lifestyle changes and treatments with medicines. Now, it's also very important to have a regular blood test to recheck your blood glucose level in case you develop diabetes. The frequency of the blood test will vary, but you should discuss this with your healthcare provider. A blood glucose test at least once a year is usually recommended. Lifestyle changes have been found to be the most effective way to stop prediabetes from developing into diabetes. Losing weight if you are overweight, increasing your levels of physical activity can help to reduce insulin resistance and therefore make the insulin that is produced more effective at controlling your blood glucose levels. Now, if you have prediabetes, you should eat a healthy, balanced diet. Your nurse practitioner or dietitian can give you details on how to eat healthy. The diet is the same as recommended for everyone. The idea that you need special foods if you have prediabetes is a myth. Basically, you should aim to eat a diet low in fat, high in fiber, with plenty of starchy foods, fruits, and vegetables. Lose weight if you are overweight. Getting to a perfect weight is unrealistic for many people. However, if you are overweight or obese, then losing at least some weight will help to reduce your blood glucose level. Do some physical activity regularly. If you are able, a minimum of 30 minutes a day, 5 times a week is advised. Walking, swimming, cycling, jogging, dancing. Now, ideally, you should do an activity that makes you at least mildly out of breath and mildly sweaty. You can spread the activity over the day. For example, 2 15-minute spells of brisk walking. Regular physical activity also reduces your risk of having a heart attack or a stroke. There are also other lifestyle changes that you can make to reduce your cardiovascular disease risk. Stop smoking if you're a smoker. Ensuring that you stick to recommended alcohol intake. A number of medicines will also been looked at to help you with your various treatment in prediabetes. Medicines that have been trialed include Metformin. Now, Metformin is a group of medicine called an angiotensin converting enzyme, or an ACE inhibitor. Studies have shown that Metformin has been very, very successful in the treatment of prediabetes. However, many doctors fail to prescribe it. Now, what follow-up is needed? Well, if you found to have prediabetes, it is important that you follow up regularly with your doctor. This will usually mean a blood test to check your glucose at least once a year, if not many more times. This is to make sure you have not developed diabetes. Your doctor is also likely to keep a check on another risk factor that you may have for cardiovascular disease. In the meantime, If you develop any symptoms of diabetes, you should visit your doctor as soon as possible. Symptoms like excessive thirst, passing large amounts of urine, tiredness, weight loss, and feeling generally unwell. Symptoms tend to develop quite slowly, over weeks or months. Don't forget to get my new ebook, and please subscribe to our channel so that we can bring you many more videos like this one in the future. I want to thank you so much for watching. I'm Ty Mason.